Hello and a very good evening to everyone joining me live. You're watching Newsline Digital. I'm Pratibha. Now, as the fight against coronavirus continues, the one hope that we have of defeating coronavirus is vaccines to be available. Now, of course, several vaccine candidates are in various stages and it is being checked as well. But once it gets the approval, there are several questions that have been raised on the availability for all. Would it be available for all for free? Would we have to pay for these vaccines? And if it is going to be in limited doses, will it be to the healthcare workers first and then to the vulnerable section, after which it will be for all? These are some of the questions that have been addressed before. As we do know, the Serum Institute of India is manufacturing 2 of the vaccine candidates. It has the approvals already, and the CEO of Serum Institute of India, Adar Poonawalla, put up a tweet that has now raised several questions on the finance aspect of it. He tweeted asking if the government of India will have 80,000 crores for vaccines for all across the country. Now, of course, this is a question that has been asked by the CEO, but if we put it in perspective and look at the amount that is allotted in our budget, it paints a completely different picture. For the financial year 2020-21 as well, the Union Finance Minister had announced a package of 69,000 crores. So much more than that needed for vaccine for all. So what's the plan? Do we have it in place? The CEO had very specifically mentioned that if we know what the plans are, we can plan accordingly for when the vaccines come in. To discuss more on this, to find out, of course, what it would be and how it would be decided as well, Dr. Prasanna, President-elect of FANA, joins us live. Many thanks for joining us, Doctor. These are some of the questions that, people have thought of quite often. But when this question comes in from the CEO of Serum Institute of India, it's of a much bigger concern. Of course, now, just about an hour ago, he has also put up a tweet saying, praising Prime Minister Modi. He has said that his vision will ensure vaccines for all. But the fact that he has put up a question, 80,000 crores to be available for vaccine for all, when our budget itself does not have so much for the healthcare sector, what do you think? Do you think that the government of India will have a plan in place? And if yes, shouldn't the talks begin right away? Because we've spoken of the vaccines coming out within just a few months.
Well, definitely, I am confident and hopeful that our Prime Minister has thought about this already. And there are talks going on and the plans going on, because he has mentioned in his talk to the nation also that the route map for vaccination is already in place.
Okay.
So definitely the government would have thought about this, and the necessary the funds, everything would be allocated. And I am sure that this will be a judgment day for India when the vaccine is available and how the government behaves at that time. And we are confident that our Prime Minister will not let us down at that time. So the required funds will be in place, and as he has told, the frontline corona warriors should get the vaccine first, and then the vulnerable population of diabetics, hypertensives, and ischemic heart diseases, cancer patients, they should get it. Then all the general population, because this is a once-in-a-lifetime event, corona. Like the COVID infection, like we had the Spanish flu in the previous century. This will be a once-in-a-lifetime event, and I am sure that our Prime Minister has everything planned and they are already in place.
Okay. So, Doctor, apart from the funds that have been allocated or will be allocated for the distribution of vaccine, there are going to be several other challenges as well that we've often spoken of. First, the storage, ensuring that it is transported across not the country from city to the remote areas as well. So this is also going to take a lot of training. We also need to have the kind of manpower to ensure everybody has access to these vaccines. If the vaccines are indeed just a few months away, shouldn't the preparations begin now for the healthcare workers as well to be trained in the process, to have a plan in place? Would you say that it's happening already, or do you think the wait will be for a vaccination to get that kind of approval, after which it will be put in place?
See, India has done it in the past. Like we had one of the largest pulse polio programs in the world. So our infrastructure knows about vaccine delivery and vaccine transportation. So it should not be a big challenge. You just use the pulse polio program as a template, and the vaccine should reach everyone. That should not be a very big issue, I feel. And definitely the government and the bureaucracy would have thought about these issues, and any loopholes are there, they will be fixed in time.
Okay. Okay, Doctor, lastly, there are some comparisons made, and I've said this before as well. It's quite unfair that, we make such a comparison. But when we talk of government schemes, even issues like demonetization, it's a completely different issue. But, what is planned and what actually happens on ground, we see a difference in that kind of a scenario. But like you mentioned, this is a completely different scenario, and we've seen what has happened with the polio vaccination. So our healthcare personnel are absolutely prepared. They are trained as well. So there's no reason to worry or think about, even if the central plan might be something else, on the ground the situation could be something else. This is about life and death, which is why the government agencies will also be absolutely sure and ensure that it is given to all in a fair manner and also in a very effective manner, isn't it?
Of course, of course. See, the challenge with this is slightly different than pulse polio. There the target population was only up to 5 or 6 year olds. Here the entire population has to be covered, and there will be operational challenges. And I hope and suggest that all in the government sector leave aside their prejudices and their priorities, work it as a national service, and see to that the vaccine reaches each and everyone. Yes, yes. So it's a service to the humanity and service to the nation. So it should reach everyone, and nobody should be biased or on the caste, creed, religion. Everyone should get the vaccine.
Okay. Doctor, lastly, there has been talk as well on whether the economically weaker section will get free vaccines, but it will not be free vaccines for all. Would you say that is fair, or given the situation, it would be better for free access to vaccines for all?
See, that's fair enough. See, those who can afford, they should buy the vaccine. So the expenditure from the treasury will be not be tested. But at the same time, if possible, if the government can do away with so many other things which can wait, then definitely they can give the vaccine free of cost to each and every one of the nation.
Absolutely. All right. Dr. Prasanna, many thanks for joining us live with your expertise on the subject. So, this was the question that was posed to the Prime Minister on Twitter. The Serum Institute of India CEO had tagged the Prime Minister asking if the Government of India will have 80,000 crores that's ready for the distribution of free vaccine to all. This means that it would not even be from the money that is allotted to the healthcare center, to the sector. It's going to be completely different, and it has to be made available to ensure free and fair access to all to the vaccines. But of course, there was no official response from the Prime Minister himself to the tweet that was put up. But in his Mann Ki Baat program, the Prime Minister spoke about vaccine for all. After which, Adar Poonawalla did respond to it as well and said that the Prime Minister's vision will ensure that everyone across the country will have the vaccines. Now, even though the government has not put across what the plan is in place, the government agencies are, of course, working. We've seen the kind of success we've had with the polio drive as well, which is why we can be sure that this is also going to be effectively distributed across the country once the vaccines get the nod. Of course, any updates on the same, we'll keep you posted on that. Thank you so much for watching this video. Please like, share and subscribe to Newsland Digital. Let me know in the comments as well what you think of the free distribution of vaccine. That's a promise that has not been made still, because there have also been some reports that perhaps vaccines will be available freely only for the weaker sections, while for others it will have to be purchased. So let me know in the comments what you think of that. Thank you so much for watching. Take care.